Assalamu alaikum, everyone. Are you a pre-med student, a med student, or a graduate? Whatever stage of your journey you're on, we've got something for everyone. Welcome to Alfaisal Medhab podcast, where we dive into enthralling topics that range from experiences in medical school to life during residency and everything in between, including career planning and personal stories of achievements, supplemented by invaluable advice and insights. Brought to you by Alfaisal Medhab at Alfaisal University, Riyadh, Saudi Arabia, featuring special guests from around the world. Please subscribe to our podcast for more delightful and illuminating episodes and become a part of our global medical community. Hello, everyone, and welcome to Al Faisal Medhab's ninth podcast. I'm Saliha Abdulrab, a medical intern at Al Faisal University, and I'm delighted to be your host for today's podcast. This episode will delve into a very important and interesting topic: planning a research year for securing a residency in ophthalmology. With their growing popularity, it has become increasingly important for medical students and graduates to understand what a research year is, how to go about securing one, and how much they support your residency application. Joining us today to help us gain insight into planning a research year is our esteemed guest for this episode, Dr. Fatima Babika. Dr. Fatima Bamikat is a seventh batch alumna of the College of Medicine at Alfaisal University. She graduated with first honors. Upon graduation, she worked as a teaching assistant under Dr. Salwa El-Hazzam in ophthalmology for a year. Aspiring to match into ophthalmology, Dr. Fatima rotated at Kresge Eye Institute in Michigan in the United States and completed an externship with Dr. Jonathan Lin, a professor of ophthalmic pathology at Stanford. She is currently a Chief Research Fellow at Massachusetts Eye Research and Surgery Institute in Boston, Massachusetts. Thank you very much, Dr. Fatima, for joining us today. It's an honor to have you, and we're so glad that you could make it.
Thank you, Saliha. The honor is honestly mine. I'm more than happy to share my experience. Thank you so much.
All right, let's get started. So, Dr. Fatima, given your extensive experience, I'm sure that you have a profound understanding of researchers. So, for those of us who are unfamiliar with them, could you please describe to your audience what they are and what the most important benefits of a research year could be?
Yeah, sure, absolutely. So, as the name suggests, it's basically a dedicated year where you spend at an institution and perform either clinical or lab research, and you're expected to, hopefully by the end of it, have some publications there. It's a very big asset for those who want to match into the US residency, specifically for competitive specialties and for those who want to go into very high academic institutions and reputable ones as well. So everyone knows that in order for you to match, there are certain criteria that program directors look at and are interested in. One of the biggest ones, especially for international graduates, is research and how much research and the quality of research that you make. Sadly, research done outside of the United States is not viewed as highly as research done inside the US. So one of the greatest ways to get a lot of publications done inside the US is to secure a good research, either pathway or fellowship or opportunity in general. There are many positions that are catered towards research, and they have different names. Mine is a research fellow, but either of them are really great to help you secure US research that will allow you to go into either competitive specialties or very high reputable institutions for whatever specialty that you want to get into. There are many benefits to research fellowships. One of them is obviously gaining a lot of good quality research that's published here in the US under American journals and under American named physicians. Another thing is to establish connections with doctors. So usually these research positions are minimum a year, if not two. Some can be even longer. Yep. And so these positions really allow you to form a connection with the people that you work with, because most observerships or electives that you make are about a month, 2 months, maybe even less. So the connection is not as strong as when you spend an entire year or more with someone. So that really allows them to see your true work ethic and your abilities, and can really help them basically support you to get into a residency position. That's why choosing the right, mentor, the right position is good, because then it helps to open gates to different institutions. But yeah, number one, I would say allows you to form very, very strong connections. Two, obviously, is allows you to publish a lot of good publications that'll help you get in. Three is it gives you strong letters of recommendation. So, like I mentioned, that ties into the connections part, where when you have very strong connections and you've already shown your work ethic and how dedicated you are, um, doctors tend to write incredible letters, especially if you spend a whole year with them or longer. So all of those factors help to allow you to get into better positions for residency and even post residency. For example, subspecialties after residency, positions after you're done with your fellowship. All those take a look at that part of your life, that research year, and who you did it with and what you gained out of it. So when you have a lot of publications from them, it helps your career overall.
That sounds really nice, actually. I feel like everything that you just mentioned, there are hundreds of benefits from what I understand. I have a follow up question. So, how does participating in a research year typically influence someone's career trajectory in the short term and the long term? I think you partly answered this question in your
That's
own.
right. Yes, I would say short term is the end goal that you're trying to achieve, which is getting into residency. Um, yeah, obviously it helps with that. It also helps in the long term, allowing you to get into other positions, whether it's fellowship positions, careers after fellowship. I would also say that for those who are not fully into, just having a clinical career and want something on the side, or want to change, their trajectory entirely to something more academic, more research oriented, it would definitely help with that. So those who want to do a master's degree, those who want academic positions in universities, those who want to switch to a more research or lab oriented career, all those, can be influenced by that research year that you do, and it can help with that. Yeah.
Okay, so you mentioned that you're basically making a lot of connections throughout your research year. And what I understand is those connections and the recommendations that you get from the people that you work with will benefit you not only for residency, but also for fellowship, also for if you wanted an academic position, also for a lab position if you wanted, so anything really. So it's very diverse, the applicability of it.
Yeah, 100%.
Okay, so it seems like there's definitely a lot of benefits and advantages. Now, I would like to ask you, from your personal experience doing a research here, are there any potential downsides or maybe disadvantages or challenges associated with it that students might be surprised by?
Yeah, absolutely. Like anything in medicine or in any career, there are always downsides to it. From my personal experience, since I'm mainly focused on the ophthalmology track, um, ophthalmology is known to be a very competitive specialty. And it's not only competitive for international graduates, but it's also competitive, highly competitive for American graduates as well.
Right.
So the number of positions in those residencies are very limited. And so the research fellowship positions are also limited. And therefore, everyone is trying to get a hold of any research position, regardless of what it is.
Okay.
But how that position influences your actual chances of getting into residency differ. I would say when you choose the wrong fellowship, it might not actually have that much, influence in you getting in. For example, there are known programs that know that international graduates are very, adamant and hungry to get in, and so they false advertise the support for international graduates, and then when they have them come in, they make them do a lot of scut work, a lot of like activities that are just there to help the clinic flow, or the hospital flow. But then when it comes to actually getting in, your chances won't be that high, or they don't really have strong connections or ties to residency programs.
I
So
see.
I would say it's very important to make sure that you choose the right fellowship. And another thing that could be a potential downside is obviously the finances. So research fellowships don't tend to pay very much, and so mostly you would be reliant on yourself or family, or support from elsewhere. Yeah, so some programs make you do a lot of scut work or just activities in general that helps with the hospital or clinic flow, but it doesn't contribute as much to you actively getting into residency, which is what's important to you. And that's either because they don't have strong connections to programs, or they don't have the infrastructure to kind of support you publish or support you with your research work. So it's very important to choose the right fellowship. That's definitely one aspect of the challenges. The second challenge I would say is finances. So not a lot of research positions pay well. The ones that do are very limited and tend to be very picky about their selection of their fellows. Um, and most honestly don't pay. And so you're on your own or reliant on family support or, other external support into financing your ability to be there. And it might involve you traveling to, a different state, traveling to a different city, a different country, attaining a visa, all these things. You would have to rely on yourself to kind of get all these things. And so that might be a hurdle for some people. It might be easy for others. It just depends on what your background is. And another thing that ties into that is your visa status. So a lot of programs favor people who either have a visa already or have a green card or a US citizenship.
Right.
Right. And so those would be in institutions that are a little bit higher up or maybe can't afford funding for a visa. So those are also some challenges that you would face. Other challenges would be the expectations from you. I know as fresh graduates or possibly even medical students, you might not be as familiar with some of the research process or how to publish, very long perspective or retrospective studies. And so some of us come in thinking that we'll learn on the job, when actually it would be a lot more beneficial to kind of start that learning process beforehand. That is one of the challenges that most people face. I think there will be always be something new you're going to learn regardless of the position that you go to. Yeah, but yeah, your preparation beforehand plays a role in how easy it goes.
Mhm. So what I understand is there are some programs that are pretty malignant, meaning that they exploit the interest that IMGs are showing in their programs, and they kind of draw in IMGs that are just innocent and they don't know what's going on, and they just kind of get looped into this program that's essentially using them. That's pretty scary. But it's very enlightening to know that those programs exist, and hopefully, people who are interested in doing a researcher in ophthalmology can figure out how to avoid getting looped into those kind of programs. Thank you for your answer. It was very eye opening. Now, let's say someone is applying for a researcher. Can you outline the typical timeline that they might go through when planning their researcher, from the start of the researcher to the end of it?
Yeah, of course. I think that the best time to prepare yourself for a research year is the year before. It might take time to get a visa to reach the US or to reach the area that you need. It might take time to gather enough money to be there or to fund yourself for certain activities or for certain things that are needed. It takes a lot of planning. So I would say a year prior to the year that you want to or intend to start your research year would be the best time. Now, depending on the specialty that you're in, each one has its own way of application. Some specialties, especially for example, internal medicine, has broad and so many research positions and opportunities, and you might have to reach out individually to different programs, different places and kind of call and knock on doors one by one and ask if you can get in. But for a specialty like ophthalmology, it is a little bit more unified. There's the website for the University of Utah, which contains most of the fellowships for ophthalmology. And so that's a great resource to use when looking up positions for ophtho. It also contains the links and extra information about each fellowship, so that it's good for you to browse. It is a little outdated, so some of the information there is not 100% accurate in this time. Some of them don't even recruit anymore, so it's good to reach out to those programs and kind of ask them how they are and if they're accepting fellows or not.
So yeah, so for ophthalmology, we know that the application season starts right after match because the fellows who are in current positions probably know where they're getting themselves into, and so the program itself wants to recruit more fellows, and that's the high time to do it. So
Basically,
because the ophthalmology match results are released in February, early February, that's when the interviews and the application for research starts. So it starts early February. Most interviews come out the week after. And then by March, most places have announced who their fellow is. Some places take a little longer. I know Kresge Eye Institute takes a little bit longer, so it might, kind of drag into March, April. But most places do release their applicants by March. So that's for ophthalmology. Obviously, every specialty is different. I would definitely kind of research that, depending on the specialty that you're interested in, and see if they have something similar, like a unified system where most programs accept fellows. And so I would say the time after match is the ideal time to apply. Now, when you apply, you're going to undergo some interviews, and then the program itself will let you know whether they accepted you or not. After that comes the process of actually preparing yourself to move. So, finding a place to live nearby, housing, all that kind of stuff. So, I would reach out to the fellows that are currently there and ask them what they're doing, the places they're in, because they've already gone through that process before,
right.
and so it helps a lot. It helps you figure out where you're going to go to and all those kind of details. And then once you start, obviously it's about learning as quick as you can, performing the tasks as quick and as well as you can. Yeah, before the year ends, because it runs by very fast.
Okay. And are there maybe specific milestones that they have to reach during the year as they're doing their research here?
I would say that's very dependent on the program and the research year, like details itself, because each year has different requirements. Each program has different, requirements. For example, if it's a clinical research, some research fellowships also combine some clinical experience where you have to actively see patients, obviously with the supervision of attendings, and you have to either perform some sort of imaging on them or tests on them. Other research, like bench research, involves you being in a lab, and they train you the first few months, to perform different activities in the lab. Some of them might, require some kind of prerequisites for certificates or something like that, especially lab research. So it really depends on the program and the kind of fellowship you're getting yourself into.
I see. So in our previous question, we discussed a bunch of like downsides or challenges associated with the research here, and now you've just outlined some of the specific milestones or something that they might have to expect during their research here. I wanted to like touch on how students could potentially avoid the downsides that you mentioned and how they could, or what are the things that they should consider when they're choosing an institute for their research year.
Yeah, that's a very good question, and a very important one too. So, I think first of all, find the social media groups where people talk openly and honestly about programs. I know one of the things that I mentioned are the malignant programs that tend to kind of take advantage of international graduates to do labor work rather than help them get into residencies. And those are usually openly expressed in those social media groups. For ophthalmology, I know that there is a Reddit series. There's also a let's see, there's also a Facebook group. So those kind of social media platforms are where people talk very openly and honestly about their experiences. I've also told that there is a Discord group. I think the Discord group is very famous for its honest, yeah, review of programs. It also talks honestly about the match process and what each program does during their match process and what the program directors are looking for and all those kind of things. Who are the programs that have a little bit of a malignant PD and all that kind of stuff. So I would say those social media platforms are great to get a hold of. Those are where you're going to find brutal honesty. The second thing is asking fellows that have been there and have done the fellowship already about their experiences. What are the hardships that they mentioned? I would emphasize to them, like, I completely understand that not all fellowships are perfect. I would really benefit if if you were to tell me a little bit more of what are the challenges that you faced. So those help, reaching out to previous fellows, and so that you have a good idea of what exactly you're getting yourself into. And the important question is how it helped that person to match. If they matched, maybe they didn't match. What is the rate of the applicants that match from that fellowship? If you've seen a fellowship that consistently matches international graduates for ophthalmology, for example, yeah, and I know that University of North Carolina and Kresge Eye Institute have a very good reputation of that, of matching their research fellows. So those programs would be great to get into. However, fellowships that people have spent years in and none of them match, that's usually a red flag. So
Right.
those are kind of the questions that I would ask. As for the other downsides, financial downsides can be difficult to kind of get around on. But I think, for example, sharing an apartment with other people rather than renting it for yourself helps. Sometimes you have to take out loans. Sometimes you need just support from family members. You just try your best to get around that. Other challenges, for example, the kind of work or familiarity with research work. There is a website called The Match Guy by, I think,
I know.
Malik Assad. Yes.
Yeah. Yeah.
Yeah. So that website is honestly great. It's phenomenal. For anyone who's interested in a research position, I would highly advise people to try and see some of the courses that they have for research, for biostatistics. Those really help. It gives you a very good base to start from when you're starting a research fellowship rather than starting from scratch. I would say one of the biggest things people struggle with is biostatistics. Some programs have a biostatistician with them, which is great. You might have a biostatistician as a family member, but for those who don't, it is handy to know how to do it yourself. You might not know how to do, like super advanced stuff, which is completely fine, but the basics helps as well. And it makes things faster because biostatisticians take time to review your paper, review your yeah, yeah, 100%. So when you do it yourself, it saves you time. It makes things sometimes even more accurate. So I think the Match Guy also has a course about basic biostatistics for clinical fellowships. That helps a lot. So I would say getting the basics down makes you faster, and it makes you a high, sought after applicant too, because if you say that in your CV or you mention that to a program that you are good with basic statistics and you do your own statistics, that's one of the things they look out for sure.
Right. 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 Makes sense. You just become more eye catching for them.
100%,
So
yeah.
we can do 2-in-1 research and biostatistics.
Yep.
Okay, so that brings me to my next question. Are there any misconceptions that students commonly have about research years in ophthalmology that you'd like to address?
Sure, yeah. I think I've touched up on some of them already, but the top two, I think number one is that they will automatically match if they get into one, if they secure one. That is not the case. Yes, there are ones that have very strong ties to residency programs and have a good, track record of matching their applicants, but you still need to put in the work. You still need to impress them. Just because you have a good relationship with the people that are in your job doesn't necessarily mean it's a guaranteed. It's still a very tough process, and applicants are getting more and more competitive by the year. So I would say you'd still need to impress the people that you work with, not just show up there and do the work. It has to be done well as well. So that's one thing. The second thing is that you would be trained and you would be shown what to do. Some
Right.
fellowships, no, you have to navigate by yourself and you
They
need
don't
to
teach you.
learn. Yeah, sorry.
They don't teach you anything at all.
No, I mean they might teach you a little bit, but there might be a lot of tasks that you just have to kind of self learn and teach yourself, look online for things, that help you learn how to do different tasks, whether it's if it's clinical or whether if it's lab. I know the fellowship that I went to, which is the one at Massachusetts Eye Research and Surgery Institution, it also required me to actively see patients, examine them, write up their notes, similar to like a residency program almost. So I had zero basic knowledge in ophthalmology at the time, and so that faced a big hurdle, that faced a big challenge. And yes, I did learn how to examine and how to, do all those tasks eventually, but it took time. I didn't know that that was something that I had to, actively learn by myself.
Was that something
So
that they didn't tell you? Was that something that they didn't inform you that, oh, you're going to be expected to do this?
I was told it was very kind of general, I guess, a general
Or,
outline of what things are, but it's you get the details when you're actually there. Then
okay.
you're like, oh, okay, I didn't know this was expected of me.
Or,
That might be the case with some fellowships, but either way, anyone can adapt, and a lot of people have done it before, so anyone can get it done. I would just say take as much information from previous fellows as possible, see what they did to adapt and what they did to learn, and do the same.
okay, so taking help from previous fellows, this should theoretically help you avoid getting into a malignant program, help you avoid maybe getting into a program that has unrealistic expectations. So really, what I'm hearing is speaking to research fellows that have already done that fellowship is the best way to really avoid making mistakes, and also the Reddit posts that you mentioned. I know Reddit is
Yeah.
really good for everything.
Yeah. Yeah, it helps.
Yeah. All right, that brings me to my next question. So during a research year, it's absolutely essential for applicants to find a good mentor, as you've mentioned. Now, I wanted to ask, when looking for a mentor, what qualities or experiences in your mentor should you look for that are most important to make sure that your research year is going to be valuable? I think based on what you've said, sometimes even if people have a really good PD and they have a really good mentor, they may still not have the best experience because it's very individualized. It also depends on how much you show up and how much you're able to do. But in general, if there were some pointers that you could give on some specific things to look for when you're seeking a mentor for a research fellowship, what would they be?
Yeah, I would again look for the people that have worked with these people before. So, for example, ask whether it's previous fellows or secretaries or whoever, anyone who's worked with that person before, how the work environment was and how it was like to work with that mentor. So, every mentor will have their own way of doing things. That's natural. However, in terms of personality and character, mentors can be different. Some of them can be a little bit more stern, a little bit more, harsh in their feedback, and very critical of you. That is something that, it would be nice for you to get a heads up on. It's
Right.
not necessarily something that you would cross out, if you know about a mentor, because they might have, the right connections to get you in, or they might have the ability to give you a very, very good, strong letter.
Right.
Um, I would say embrace those challenges for sure, and try and adapt to them as much as you can rather than shy away from them. Because typically, at least from my experience, I realize the higher you go in the ladder, the more difficult personalities you tend to face, but definitely learning how to manage your way around them and how to you know like maintain a good relationship with them, regardless, it is a good skill to have as a physician anywhere, because you'll always find challenging people to work with in any setting.
I would say that not just like your mentors, but also like people around you, simply colleagues can just be so hard to work with sometimes. And even
Yep.
patients, not to mention patients can be hard to work with.
Yeah,
Um,
100%.
yeah, I also want to ask, so you mentioned that's really important to speak to previous fellows who've done that fellowship before, to ask them how the mentor was and what the work environment was like and so on. But what about qualities of the mentor themselves? Like, for example, someone who's done, or maybe someone who does a lot of research in a specific field that you're also interested in or something like that.
Yeah, for sure. If you find a person who is currently doing something you're interested in, whether it's a topic, whether it's a field of disease, something like that that you are interested in, yeah, definitely jump on that wagon because they will be able to be the ones that kind of embrace your passion for that, subspecialty or field, and they will be the ones to guide you the most. So that is one factor to look into, which is mutual interests in subspecialties.
Okay.
Another thing to look into is how often did that mentor call for the people that worked under them. For example, some mentors go as far as call individual program directors and be like, hey, this is such a great applicant. This person will do so much and is amazing.
Like, how much are they going to vouch for you, really? That's what you mean.
Yes, exactly. So how
Okay.
much they vouch for you and the extent that they're willing to, spread the word of how good of a applicant you are. Another thing is the quality of their letters. So if you've noticed that they write really good letters for previous fellows or previous applicants, that's a good sign. Not everyone will necessarily share that, but just by asking, again, previous people that they worked with, that tends to be something that people, share openly. So I would definitely ask them, do you feel like the quality of the letter or the support in the letter was, high or not? That's yeah. So that goes back to the how willing they are to vouch for the people that they're with, because not all of the mentors do that. Not all of the mentors have time for that. So yeah, that's something I'd look into.
So you're saying that it's really important to make sure that the mentor you're choosing is very supportive.
Yes.
Okay. And the way you would know that is by asking other fellows who've been with that mentor.
Yeah, honestly, asking other fellows helps resolve 99% of your questions regarding any fellowship because they're the ones who went through it and no one else would know how it's actually like. Yeah.
Right. That's true. Makes sense. Okay. Um, do you have any personal experiences, maybe, or anecdotes to highlight the importance of, making sure that you find the right mentor for you and make sure that you're making sure that you're in the right research environment?
Yeah, sure. So one thing I would say is that you never know which door opens up that will lead you to a good position. So, for example, when my first observership that I ever got for Kresge Eye Institute, it was through a random friend of my husband's who had his wife get treated at a clinic there,
Oh,
and
wow.
I went with her to one of their appointments, and while I was at the appointment, I was very interested in what the doctor was doing, and so on the spot I asked them, hey, do you mind if I shadow you for a few weeks? And they were surprised, but they openly agreed, and they were like, yeah, of course, absolutely. And that's when it started. And so I then shadowed them for a few weeks, and then that turned into an interest in trying to do research with the actual, institution. And so you really never know which gateway leads you to the position that you go through. I know that doing things in the US in general can be challenging for people overseas, but
Right.
reach out to those that are already there. Reach out through various means, email, calls, internet, social media platforms. There are
Mhm.
different avenues to get you a position. It's no longer just a formal, online application or something like that. Even through social media posts, I know there are many platforms out there that post positions. I know that, for example, for research fellowships, the position that I'm currently in was posted. I think it was it I can't remember the name, but it was one of the like social media platforms, and that's very common for ophthalmology. That positions might be posted either on Facebook, on X, I think, which was Twitter before, on all these kind of social media platforms. I would just kind of subscribe to each and every one of them. We're at a day and age where it matters.
Right. It is.
So follow as many of them as possible. Sometimes it's individual attendings. Sometimes an attending would post on their own social media platform that they have a position that they want someone to apply to. So you really never know. There are so many avenues where you can get a good position. So be open, be aware of what's happening, subscribe to different, social media platforms and accounts that are related to the specialty that you're interested in, especially if it's related to a residency program that you're interested in. For example, a lot of residents now create like an Instagram account for their residents to showcase, what their resident life is and all that kind of stuff.
It's really fun to like just observe what they're doing and be like, oh my god, I could be there.
Yeah, exactly. That's one thing for sure. And then another thing is that when they post about, whether it's positions or other things, it can help you be the first person to know about them. So yeah,
Right.
subscribe to all of
I
these.
think
It's a good
people
idea.
notice is these residency programs, whenever they post like a photo, they tend to tag the residents and like they tell them, oh, this is so and this is so, which makes it so much easier if you are looking for like someone who's been there to reach out and ask them, oh, how was your experience? How's this program? And so on.
Yeah, absolutely. Yeah, 100%. That's a good idea.
I do like your story, by the way, about what was it, your husband's friend or something like that? Yeah.
Yeah, husband, friend's wife.
Yeah.
It's like a long.
I know something similar. Well, not exactly, but I know someone who was doing a research fellowship with a neurosurgeon who treated his mom for brain cancer like 25 years ago, and he was
Oh,
still
wow.
working, and he was able to do a research fellowship with this person. And the way he approached them, he was like, "Oh, you treated my mom in so and so and so year." Do you remember that? And then he was like, I do. And then he was like, oh, can I work with you? And he was like, yeah, sure. And so they just, that's how he established that connection, which was very interesting to me. Things work out in mysterious ways.
Yeah, it does.
All right, so coming to my next question. Research years often come at a time where you have a lot of things going on in your life. For example, you may be trying to also apply to the match. You may be also trying to do other things. Some people might be getting married. Some people might be going through another like transitory phase in their life. So my question is, when you're going through so much personally and professionally, what kind of advice can you give to someone who is looking for a research year, who may also have other commitments like family, other responsibilities, or clinical duties? How can they effectively balance these other commitments with the research year that they're trying to take up?
Yeah, that is a very important question because, like you mentioned, we're at an age where family becomes a priority and it becomes something that, can supersede sometimes the other things we're doing. I would say that one thing that helps is support. Whether it's support from friends, whether it's support from family members that are nearby. I personally went through, a situation where I gave birth. I had a daughter, and so that was challenging to kind of balance along with my fellowship, which was very demanding in itself. But how I balanced that is with family support. So my mom flew over, my mother-in-law flew over. They spent a few months with me. That helped a lot. It helped me transition, and it also helped with, finding a nanny, just having. So family support is very, very important. Now,
Right.
not everyone can get family support, especially, way out here in the U.S. Some people, most of their family are in, um, like Saudi Arabia, for example, or other countries, then that's when it's important to have friend support. And there are many Alfaisal graduates now in various different states. I know that there's like, I think minimum 7 here in Massachusetts. So there's a lot of us now. And with every year, the more we match our students, the more Alfaisal graduates there are. So it's wonderful to have someone from Alfaisal back you up. And thank goodness we're an open community and we're really into helping each other out. So it's a good idea to reach out to them, find out who's around you, ask seniors. You never know. Those will help you out as well. Another thing is being honest with your program. So, for example, if you need, for example, like me, a maternity leave, and you need at least a minimum 2 months off or 3 months off, being able to ask for that, leave can be daunting for a lot of people. I know it was daunting for me.
Yeah.
Yeah, you don't want to be like, or sound like you're slacking off or that you want extra privileges that you weren't assigned initially. But I would say a lot of mentors are very understanding and they're human beings and they went through life the same way you did. I think the generation before us definitely, had struggles with their own balances with personal life. So they understand it and they get it. And most are actually very open in helping you and supporting you and getting you the help you need. So don't shy away from asking the program for help and asking the program for time off, leaves, whatever it is that you need. Because at the end of the day, yes, your career is important, but you know, you can't always sacrifice family. So
Right.
just be very open and honest, and don't shy away from asking for things that they need. The worst thing they could do is say no. And in that case, you would have tried, and you know, your work ethic will shine through regardless. So it's not a bad thing to ask for these things. Another thing is good relationships with the peers that you work with, so that they could cover your shifts sometimes, or they could, you know, do some of the things that you need to be done, or they could help you out. So
Mhm.
establishing a good relationships with your peers
Mhm.
can come in handy in the times and difficulties when you need someone to cover for you. So yeah, I think that's important as well.
All right, thank you so much. I think that was really insightful advice. Now, I want to specifically talk a little bit more about researchers in ophthalmology. For students that are considering a researcher in ophthalmology, what are some things that they can do in order to prepare and maybe like optimize their CV and their application when they apply?
Yeah, excellent question. So for ophthalmology specifically, experience. So yes, you might be a medical student, or you might be a fresh grad that knows nothing about research or knows nothing about the process of research. Trying to get exposed as soon as you can is the optimum way to go, whether it's by reaching out to the doctors that you shadow or that you work with in your internship or your clerkship. I know that for me, we had our clerkship at you know, King Faisal Specialist Hospital. I was introduced to both Dr. Salwa Hazza and Dr. Maali at the time. During the clerkship itself, I reached out to Dr. Maali and was like, "Hey, Dr. Maali, do you mind if I, you know, write a paper with you or get involved with any research project at all?" And then she asked me, she was like, "Are you serious about this? Do you actually want to do this?" And I was like, "Yeah." And so 2 weeks later, she allowed me to join in writing a case report, and I wrote it within a span of a week. The next month, we got it published, and that was my first publication ever.
Wow. Okay.
Yeah,
Very quick, actually.
yeah, Dr. Matt is very quick. So I would say we tend to shy away from approaching attendings and, you know, faculty in general at any hospital, because we're trying to show good manners, we're trying to show, but we need to break that barrier of, you know, feeling intimidated. We need to be able to, yeah, raise our voices, reach out to whoever, and talk openly and honestly with these attendings and be like, "Hey, I'm willing to jump into any, you know, research project, please let me help." Doing that shows how passionate you are about the field and gets you opportunities. Basically, that's the way I was able to do it. And eventually that helped me get a publication with Dr. Sarah Hazza as well. So these, yeah, just not being shy of knocking on doors and asking physicians directly helps big time when you're a medical student. When you're in your internship, you get to have hands-on experience, and so asking, you know, attendings or physicians for research and research projects is a lot easier. And so definitely make the most out of that. Usually it's just a month, it's just like 3 4 weeks. So make the most out of that. Ask early. Don't wait for a week, don't wait for 2 weeks. Ask early on. That helps you get on projects. And those small projects are the ones that eventually build your CV. The more you do research, the better you get at it. And so the earlier you get exposed, the better you'll be when you're out of internship. Yep.
Right, right. I totally agree with that. I also wanted to ask, are there like any courses that you might suggest students do? Like you mentioned at some point that knowing a little bit of biostats goes a long way. So what might someone do to ensure that they know a little bit of biostats?
I honestly like the course at the Match Guy website. I think that one, it was more than enough to help with basic clinical you know, fellowships.
Right.
uh I think anything beyond that, I don't really think you're required as a, you know, as a physician, because at the end of the day, you're not in that position to become a researcher, you're in that position to become a physician that also does research.
Right, right, right.
And
Okay.
there's a
Right.
difference. So I would, yeah, I would head on to that website and learn from that. That was all I learned from that, in addition to my step one and step two studying, to be fair. I'm not sure of any other sources for biostat, but if you're looking into like a resource for ophthalmology, there is a website called iGuru. that has amazing videos. They're very short. They're like maximum 10 minutes, that summarize very important topics and diseases and stuff like that. And it also has quizzes and daily fundus photos and all those kind of things that really help you familiarize yourself with different aspects of the field. And I think it's important to know what's in the field to become a good researcher in it. Otherwise, you're not going to know, what you're talking about. So the more knowledge you have in the field that you're in, the better of a researcher you become. For example, if you're interested in plastic surgery, learning more about plastics helps. If you're interested in cardiothoracics, learning about those and the diseases in them helps. So whatever it is, learn more about the diseases and the pathology in that specialty, and you'd be a better researcher.
Okay, got it. Makes sense. Oh, one more question. So let's say during your internship as intern students at Alfaisal, we have the option to do like at least 1 month of an elective and 1 or 2 months of a surgical subspecialty. So would you recommend that students do all of or as many months in ophthalmology as possible if someone is really seriously interested in ophthalmology?
Yeah, 100%. I would say if you are interested enough, though, I would try to get as many electives in it as possible. And I would have all these electives at different spots. That way you get exposed to different people, different opportunities, and different like research opportunities. I know that, for example, SMC, early on when I was a medical student there, they didn't have ophthalmology rotations at the time, but now they do. And in fact, I think now they even opened their residency, their ophthalmology residency, to Alfaisal students. I particularly know one Alfaisal student that is currently a ophthalmology resident there. So you really never know. I would try different hospitals and do as many rotations there as you can. Yeah.
Okay, and that would also expose you to doctors there, and potentially you could ask them for research and so on and so forth, like you mentioned. I have another question. So far we've been talking a lot about researchers, and we've been talking about researchers in ophthalmology. But what do you think it is about ophthalmology that makes it unique for doing researchers? Like, why does ophthalmology require researchers? I mean, I know that there's other specialties as well that require it, but in this case, what do you think it is about ophthalmology that necessitates this?
So I think that very highly competitive specialties, whether it's orthoplastics, any of those very high competitive specialties, tend to value research a lot, and mainly because most applicants to those specialties have very good CVs. They have very high scores, very good letters, rotations, all those kind of things. So usually what makes the international graduate stand out the most is research. Research is one of those things that people don't really like to do. They shy away from because it's a lot of work. It's not maybe as fun. You don't really, do procedures or anything when you're doing research. So it's seen sometimes as more on the boring side, and so not a lot of medical students like to jump on that wagon. So that is usually the factor that makes IMG stand out the most, and the more you have on there, the better. Now it's become so competitive that even American grads are expected to have several publications to match in ophthalmology. So now IMGs have to publish even more papers. So yeah, you're going to find this trend in basically any highly competitive specialty. What makes ophthalmology unique is that it's a very fast advancing field. So for example, every year, different drugs, different treatments, and different modalities are brought out and FDA approved. And so there are very drastic changes and shifts in the field every single year. For example, just 2 years ago, there's a medication called Tepezza that now is known to help people with Graves' disease and kind of reverse the ophthalmopathy that comes from Graves' disease. Yeah, and when I was a medical student, I was taught that nothing can reverse the pathology from that disease, and that once the patient gets the large exophytic eye, there's nothing you can do. But now there is a medication that does that can reverse those findings, so that's something new. We have honestly, there's so many medications out there. There's gene therapy, for RP disease. There's so many examples out there for new things that are coming out. And so what brings about that change, what brings about those new medications and that shift is research. And so you can be a part of those trials. You can be a part of those medication, trials and clinical trials to help bring about that new change. And that would be pretty awesome, if you get a hold of that. So that's why ophthalmology is very, very fast paced in that regard. So it tends to, depend on research a lot.
Evolves very fast is what I'm understanding.
Yeah.
We also learned that there's nothing you could do about Graves' ophthalmopathy. I don't know how to pronounce that. But yeah, that is pretty cool, actually. Thank you so much for that very thoughtful discussion. It was very informative, and I really enjoyed speaking with you. I have a question of my own, if you don't mind.
Of course.
So, what are you specifically interested in ophthalmology? What is there a special, like maybe subspecialty of ophthalmology that you're particularly interested in that you want to do down the line?
Honestly, that's a good question. Ophthalmology is very pleasing in the sense that it gives a very good balance between personal lifestyle and finances, and a good combo of both medicine and surgery, where you get to do procedures, you get to do surgery, you get to see patients actively and deal with medical conditions. So it has a big variety of things you can do in it. And it gives you the best of both worlds in terms of personal life and professional life. But to me personally, I'll never forget that when I was a medical student in Alfaisal, it was very hard for me to study things on time, on the same day that we get the lecture. It's not always feasible, but ophthalmology was the only subject that I studied for fun.
Oh, wow.
Completely for fun.
Okay.
Yeah, I just enjoyed the topic so much that I would read ahead of time just because I wanted to know, how these different diseases manifested. So to me, I found it just fascinating. I found the field very, very intriguing and interesting. So that's for me personally. In addition to that, I do love surgery, but I tend to get weak in the knees when I stand too long. So when I was in one of the vascular surgeries, which was like 4 or 5 hours, I was like, I can't do this. But the good thing about ophthalmology surgery is that you're doing them all sitting down. So that's
Yeah.
a very big perk. Yep.
You're talking to someone who's interested in surgery right now.
Oh yeah.
And you're right. It is a big downside or challenge, I would say, to be standing for so long. Thankfully, though, you can sit for like 30 seconds at a time in our ORs. So it makes it a little better. Not too bad.
Yeah.
Thank you so much for all your answers. I think, this talk definitely gave some much needed clarity and, make things a lot easier for people who are interested in not only ophthalmology, but also just simply doing a research year for any competitive specialty. For example, even general surgery or neurosurgery, these are specialties that are becoming more and more competitive by the day. And all your answers, I'm sure, would benefit people who are interested in those specialties as well. Now we're coming towards the end of our podcast. Dr. Fatima, thank you so much once again for joining us today and for providing such helpful insight into research years. I'm sure our audience today will find this as beneficial as I did. And yeah, thank you so much.
Thank you, Salah. I appreciate you, and I appreciate the entire Faisal team for making this happen. Thank you so much for giving me this opportunity to speak about, my own experience and give my own advice. I love these kind of podcasts just because it really helps people and gives an insight into these different, aspects of the field. So thank you, and I appreciate you specifically for reaching out to me and helping me out. Thanks.
Thank you so much for being here. It was a joy to have you on our podcast. As this episode comes to a close, we hope all of you enjoyed the world of medicine with us. Thank you for tuning in. Remember to subscribe for more compelling content and keep working hard. Stay motivated and engaged until we catch you on our next episode. This is the Alfaisal MedHub podcast brought to you by the students of Alfaisal University. Thank you so much.
Thank you.